Dimayuga, and this probably has become recently the most requested topic that we've had. Because of the success of people on the Migrate 28 program, people are asking, how do I speak to my healthcare professional and accurately communicate what I've got my hands on? So that's what we're going to talk about tonight, or I should say Dr. Mike is going to present about tonight. And Dr. Mike, are you with us?
Yes, I am, Winston. How you doing?
I am great. I'm great. I'm really excited to learn from you. So I am going to let you take this away because I know you have a very unique perspective on how you would want someone to speak to you about what it is that we're doing.
Absolutely. So you went to the doctor's office, and I chose to start this presentation with this slide because typically what happens is you have a doctor's visit scheduled, you've started on the program, you've had some success. You might not be where you want to be, but you've already had some success. And specifically from the doctor's perspective, a lot of things are rapidly improving even though you're not seeing all the weight that you want to come off. For example, your blood pressure may be already much better than before. Your inflammation is markedly down. Your blood sugars, if you're diabetic or pre-diabetic, are rapidly moving back into a normal range, and typically the doctor is at a loss to explain how these things are happening. Excuse me. So you go to the doctor's office, and what I want to do quickly before we get any further into the presentation is survey the field. How many of you have been to a medical practitioner's office and were asked, what are you doing? And if you have access to Woodson's cell number, text her your answer, or go ahead and answer on the right-hand side of the screen where you have that chat box. Type in yes or no.
Okay, we are waiting. I like the audience participation ones. These are the most fun. Oh, here we've got some takers. Yes, I messed it up. I talked too much. Wait a minute here. Some other people are typing. Bear with me. Yep, we've got another yes. What did I do wrong? How do I do this? I want to. So, yeah, we've got quite a few people. These are cute. Okay, there you go.
So, interestingly, of those who said, yes, I've been, or I tried, or I know it's coming up, and how many of you were at a loss or feel that you're not properly equipped to answer the question, and more importantly, to answer the question sufficiently in the typical 2 or 3 minutes that you're going to get to speak? Lastly, how many of you would like to know what to say? So moving on to the next slide, my perspective on this is somewhat unique. And this will apply to both clients on the program as well as health coaches on the program. And the perspective is fairly straightforward. Over the last 2 years, because I am part of the health panel, I have been asked to talk repeatedly to medical practitioners, doctors, chiropractors, nurses, holistic health specialists, acupuncturists, you name it. And first thing that drives the medical practitioner to look at this is obviously you, the participant, having success, because we come from a very unusual background. If it doesn't work, we really don't want to know about it. It doesn't work. It doesn't matter how good it looks on paper. It doesn't work. But when we see something that works, because we are coming from a science background, we want to very quickly vet. We want to very quickly analyze whether or not it is something we can pay attention to or just maybe one of those inexplicable things that may not be repeatable. So I have learned through the course of the last 2 years certain things that medical practitioners are looking for, and I have also learned, okay, this is what the program does, and if I respond in this way, they rapidly get the program, and at the end of that discussion or even brief statement, the answer typically is, well, that makes sense. Well, that's very logical. How can I learn more? So if you all want to do and learn how to do that, here we get going. Why does this program work? How to explain it and do all of that in 1 minute or less. That is a promise I'm going to deliver to you all tonight. So moving on to the next slide, the program has 4 core components. And it is important to understand, we're going to discuss a little bit, but these are the only 4 things that you need to know in order to comfortably explain and present the program. The core components are homeopathy, nutrition, detoxification, and education. We're going to briefly talk about each one of these and how it plays into the bigger picture, and then summarize with the 1 minute or less way that you can explain the program. So the next slide talks about homeopathy itself. It is a medical philosophy and practice based on the idea that the body has the ability to heal itself. It was founded in the late 1700s in Germany. And in Germany and in most of Europe, homeopathic medicine stands equal with regular or allopathic medicine, which is what I practice. Now, the key components, there are 2 key components to homeopathic medicine. Number 1, it, for the most part, almost exclusively uses naturally occurring substances. This is a big difference from my field, where we use synthetic substances to effect change. Secondly, a core principle of homeopathic medicine is that the body, given the proper tools, will be able to heal itself. My field of medicine, allopathic medicine, if I want, for example, to correct a cholesterol problem, I will put the patient on a drug that forces the liver to stop making cholesterol. Most times it works without side effects. Sometimes there are some side effects. Infrequently, we kill the patient. Now, that's not exactly good medicine. But it has been widely accepted, homeopathic medicine has been widely accepted as safe since 1938 in the United States. What Slendrix and Accelerate do for us, we know that it controls the cravings. We know that it controls cravings specifically for carbs, so that the mindless eating diminishes. But it also quiets down the noise, if you want to term it that way, the noise in the head that's constantly getting in the way of you staying focused. So what Slendrix and Accelerate do is, through the homeopathic preparation, it quiets down and delivers neuroendocrine balance. You don't need to remember any of this stuff just yet. You just need to grab an overall view and picture of what we're talking about. But that is what the homeopathic component does. The second component, and I put in a cartoon, and I could not resist it. I could not resist this when I saw it. There is malnutrition, and then there is malnutrition. And although it is somewhat of a cartoon, it is the absolute truth from a medical standpoint. The obese or overweight individual is in fact malnourished. The next slide highlights this, and that is the individual who is carrying too much weight, in fact, has been consuming lots of calories, but the calories are devoid of nutrition. And unfortunately, very much those of us living in highly industrialized countries with processed food products are being exposed to this on a daily basis. In fact, most of us are unconscious about it. We eat prepared food. There's a great deal of calories in it, but the nutrition value has diminished so much that the body is now saying, we don't have the nutrition we need, you need to eat more. But if we eat more of the food lacking in nutrition, we gain the calories, we gain the weight, but we don't get the nutrition. So the body says, yet again, go eat more. Now, tying these first 2 core components together, the goal of homeopathic medicine is to rebalance the body and supply it with the raw materials that it needs. If we are not supplying the body with nutrition, which is one of the most important building blocks to heal itself, then the body cannot heal itself and it cannot get out of the problem state. So the second core component of our program is high intensity, high quality nutritional supplements. And even if you're eating mostly fresh produce, organic produce, non-GMO produce, even if you're eating about as clean can be, unfortunately, the produce produced in the United States today, depending on which study you look at, is anywhere between 14 to 80% deficient in the core nutrients that food products, the produce rather, used to have 75 to 100 years ago. Our soils have become depleted from industrial farming. So even if you're eating as clean as possible, you're eating fresh produce and fruits and vegetables, and you're eating clean proteins, and everything is organic and non-GMO, there is still likely holes or gaps in your nutritional profile. And rather than run the risk of running short on something, we just put you on high-intensity, high-quality nutritional supplementation. That's the second core component. The third core component is detoxification. Now, think about this for a second. If we use a homeopathic process, which depends on giving the body everything that it needs to restore itself to balance, and we give the body all the nutritional supplements and support that it needs, but there are toxins that we are exposed to on a daily basis, and we do nothing about the toxins, at some point, the whole process breaks down. Toxin removal is essential in order to allow the homeopathic process to take place and continue to function. If you allow the toxins to stay in place, the process will ultimately slow down. If the toxin buildup is not addressed, ultimately the weight will come right back on, because the toxins that we're talking about, and this is shown, and we will come to this on the next slide, the toxins that we're talking about are for the most part fat soluble. So as you lose the fat, if you do not remove the toxins, your body will have to put the fat back on. Now, when I talk about detoxification, I have a very specific concept in mind, and it is a medical concept: the ability to bind and physically remove toxins from the body, not just the bloodstream and not just from the gastrointestinal tract. I was born and raised in the Philippines, and although my mom was originally from St. Louis, Missouri, and so I was a little bit better prepared to understand American idioms, it was still a little bit of a challenge to me when I first saw this word cleanses. And it took me a while to understand that the word cleanse or cleansing or cleanses really was code for something else. Once I figured out what it was code for, then I understood what everyone was talking about. The short word, the other word for cleanses is diarrhea. Now, don't get me wrong. Having the occasional bout of diarrhea is in fact good, because the gastrointestinal tract can really only respond to toxins and other irritants in one of two ways. You'll either vomit or you'll have diarrhea. So, if something is in your gut and it shouldn't be there and your body is aware of that, it forces a bowel movement, a diarrheal movement. It flushes everything out, and that's good. But it can only really get rid of what's in the gut. When I talk about detoxification, I want a system that will pull stuff out of the body tissues, mobilize it into the bloodstream, pull it out of the bloodstream, trap it in the gut, and then fine, you can have your cleanse or your diarrhea to flush the toxins out. And when I saw a component of this program that did specifically and exactly that, with scientific validation behind it, I said, okay, this I know, this I understand, we can go forward with this. Now, the next slide will highlight why detoxification is so important and such a key component to all of this. Most of these toxins, like I had explained earlier, are in fact fat-soluble. And they could be contaminants and pollutants, insecticides, pesticides, food additives, drugs, alcohol, whatever the case may be. Some of these are also drugs that you're taking for medical conditions. Woodson, on my end, there you go. The slide finally came fully in place.
Sorry about that. It's a high definition picture. There you go.
There you go. So what many people sometimes don't realize is that you might have a medical condition that requires a particular drug for that condition. But as we all know, many drugs have many side effects. And these side effects are in fact toxic. I just talked about the cholesterol medication. Yeah, I can help lower your cholesterol, but you might run the risk of liver injury or death. There was a class of type 2 diabetes medications. Groundbreaking. It was amazingly effective. Unfortunately, people started dying. So it was taken off the market approximately 14 years ago. So it's one of those things, yeah, you might need a particular drug for a particular condition, but it does not mean that it's completely safe, and it does not mean that it is not also a toxin in some other part of your body. So if you do not remove those toxins, you're going to ultimately run into trouble. Part of our program calls for a fair amount of water intake, and that has to do with the extreme right side of the slide. These toxins are converted from fat-soluble to water-soluble, and then we flush it out with the kidneys by using a lot of water. But the more important route of elimination is through the gallbladder, through the production of bile, and then ultimately being bound into the stools. And this is where the detoxification program magnifies and amplifies the efficiency of that system so that the toxins do not stay in the system and do not have a chance to redeposit. So the third core component of our program is a scientifically validated detoxification process. Lastly, moving on to the next slide, and I will give the audience a few minutes to peruse the slide. The slide says, if we keep doing what we're doing, we're going to keep getting what we're getting. This is really the working definition of insanity, doing the same thing over and over again and expecting a different result. Because if poor lifestyle choices got us into trouble in the first place, we must change those patterns. To expect anything different by not changing our lifestyle patterns is unrealistic and ultimately an exercise in insanity. So I have gotten to the point where if somebody wants to start the program, but they resist changing, especially food habits, I tell them, the program's not for you because you're not willing to change. And that is the fourth core component of our program. We talk about education because, as the next slide highlights, our habits got us into trouble. We also know that habits are extremely hard to break. Academic research says that new habits will take anywhere between 18 days to 284 days to develop. That's a lot of time. That's nearly a year. So if you start on a weight loss program, not necessarily our program, you start on a program and there's no coaching, no education, no lifestyle modification, and no health coach constantly reminding you of what you need to do, and this happens to people over and over again, at the end of that particular program, you're going to lapse right back into what you used to do, and therefore, no surprise, you're going to have no long-term success. The weight is going to come right back. Now, those of us who are coaches in this program understand very, very intimately the next few things on the next slide. When we talk to people, the first thing we really have to identify is, are they willing to change a habit? And if the answer is yes, we go through a whole host of things, guiding the individual to developing a new habit. But if the answer is no, guess what? We're done. Are you willing to change your fast food habit? No, I love fast food. Good, we're done. No need to talk any further because it's ultimately not going to have long-term success. But think of the next individual you see mindlessly going through a bag of chips. When you typically walk up to them and ask them, are you hungry? The answer more often than not is, no, I'm not. So then you ask them, so why are you eating? They look at the bag, they look at you, and they go, I don't know, and they shrug because it's a habit. It's a habit dictated by the time of day. It's a habit dictated by where they are. When they're at home in the kitchen cooking dinner, their habit may be that they're going to work on a bag of chips. It could be sitting in front of the TV. It's a habit. There is a cue. the location, the time, whatever the case may be, and then there's the reward and there's the routine. We, the coaches on the program, learn to identify these things and interrupt the pattern so that we can help you learn new habits. But like so many other things in life, if you don't have a good coach, you might not have the results that you want. So this is where our program has a leg up on the other programs. Yes, we have health coaches. More importantly, the health coaches and the entire program is supervised by physicians. So, tying all these things together, and I beg your forgiveness for having taken the roundabout route, but bringing all of this full circle, if any of you care to read what's on that screen and time yourself, how long it takes you to read that, and then send the information into Woodson. Go ahead and do that, and we'll take a few seconds of silence.
Okay, I've got results. Okay, 30 seconds.
Okay.
24 seconds.
Okay.
Let's see. Some other people are typing. Somebody's reading it again. 20 seconds. Let's see. 26 seconds. So yeah, this is fantastic.
So I'm on a medically supervised weight management program that has 4 core components: neuroendocrine rebalancing using homeopathy, high-intensity nutritional supplementation, scientifically validated detoxification, and lifestyle coaching. And the next slide says that it should take you no more than 16 to 20 seconds. Now, I will grant you, I've had a lot of practice saying those words. And when we first did this presentation live with a live audience, the lady that was brave enough to volunteer stumbled on the word homeopathy. She had to practice it a couple of times. But even then, it took her, I believe, 24 seconds to say it. With a little bit of practice, you will get it done in between 16 and 20 seconds. These are the 4 components that when I talk to medical practitioners, and I say it in this sequence, we use a homeopathic system for neuroendocrine rebalancing to get rid of cravings. We supplement with high-intensity nutritional products. We detoxify with scientifically validated protocols, and there's an extensive and complete lifestyle coaching supervised by medical practitioners. And that's why we have the results we have, and that's why no program can touch us. The response inevitably is, well, that makes sense. Well, that's logical. There's no pushback because this is language and concepts that they completely understand and they will be following. And you will be surprised if you're talking live with a medical practitioner and you say it in this sequence, you will actually see them start nodding their head. Their eyebrows will shoot up. They will go, yeah, that's what we need. So the next time you are at your medical practitioner's office and somebody asks, what are you doing? And you know that you have less than a minute to tell them. Wait until they're done checking your vital signs. Wait until they're done getting you to the room. Wait until they're done. And then when they look up and you say, and ask, is there anything else before I leave? You can say, I'm on a medically supervised weight management program that has 4 core components: neuroendocrine rebalancing using homeopathy, high-intensity nutritional supplementation, scientifically validated detoxification, and lifestyle coaching. And you should sit back and be prepared for the results. So that's it. That's what I have for you all tonight. I hope it's been helpful.
this has been extraordinarily helpful because the results that we're getting are phenomenal, and people do want to share, and they do know people in the industry, and more importantly, how to respond when someone asks. And I think it's so unique that the results that we're getting, people are asking us what we're doing rather than us necessarily sharing it, even though we love sharing it with people. And so I want to thank you because our staff, this is the question that we get. How can I get someone to talk to my doctor? Or how can I get someone to, what am I going to say to my chiropractor? Or I know a naturopath, or I know of this, I know of that. And so I cannot thank you enough for this training because this was absolutely fantastic. And everybody, remember, we want your photos, your measurements, and your stories. Tell us how you feel. Tell us if there's been a dramatic difference maybe in something that you've noticed that maybe we haven't covered, like how well you're sleeping, or how happy you are all of a sudden, or whatever the case may be. Send us your recipes. We have gotten some really cool recipes that we're putting pictures to right now, and we're breaking them down to where they'll all be in the same format. So send us your recipes so that we can get them posted, and send all of it to migrate28@gmail so that we can put it on our Facebook page. Go ahead and like it so you can get those updates every single time we update the page. And we cannot wait to see you next week. And Dr. Mike, we cannot thank you enough for arming us with the tools that we need, not only to get our health back, but also to effectively communicate it to someone that we're excited that they either asked us or that we want to share it with.
Absolutely. One of the things I truly believe in, knowledge is power. If you know how to speak the language, a language that they understand, you'll essentially be talking on an even plane. So, my pleasure.
Well, everybody have a fantastic evening. We will see you next week. Thank you again, Dr. Mike, and thank you everyone for joining us.